Thank you, Carl. Thank you. Good afternoon, everybody, and welcome to our coronavirus update for residents and team members. I'm Ann Gillespie, your CEO. Let's start with a moment of silence. Thank you. Before we hear from Megan Barbour, our COO, and Dr. Hanawe, I want to just let you know that I understand that this is a very scary time. And I also want you to know that the safety, health, and well-being of our community is my top priority. So we're going to do everything we can to keep everybody safe. We've spent the past few days putting our plan and protocols in place, and as of this morning, we've moved to a higher level of vigilance around visitors and screening, which Megan is going to review with you. The most important thing we can do right now is to take care of ourselves and each other. With that, I'll turn it over to Megan.
Thank you, Ann. Good morning, everyone. So I wanted to talk about what we're doing kind of going forward. You've had some communications out about essentially our soft campus closure and what that means, and you'll be getting more information out in the Courier, more information out on our website, and we're updating our Facebook page as well. So I wanted to talk about some further restrictions that are going on. You may have heard yesterday evening and throughout the day, Governor Hogan had a lot of announcements. And one of the first ones that he focused on was really limiting visitors. At this time, Collington would like to go to a no visitor policy for only essential visitors. Again, we're asking if you have visitors that are coming on campus to please ask them to reschedule at this time. Essential visits could be things such as having a family member who's coming to pick you up for a doctor's appointment and then returning you to campus. It could be a delivery that's being made, such as through Amazon. Packages are being delivered and then going back. And for our health center residents, who are our most vulnerable population, it is imperative that we try to limit our visitations. So while we understand that for the well-being of residents, social well-being, that we want to try our best to try to help them through this as much as possible. Alternative ways that we can help is by having phone calls. Our team members are willing to help set up Skype and FaceTime messages, but to protect our most vulnerable population, we're asking that you restrict your visits to the health center at this time. For ancillary physicians who normally come and visit, such as dermatology, audiology, and podiatry, we're pausing those visits at this time. I've been in contact with many of them this morning, and they are in agreement that they feel that at this point they should only come on campus or see residents if it's an emergency. We are also continuing with our culinary carry-out service. Thank you for the feedback that many of you gave. It sounds like it was a pretty good experience under the circumstances. So just a reminder that the breakfast hours are 8 a.m. to 10 a.m., that the lunch hours are 11:30 a.m. to 1:30 p.m., and the dinner hours are 3:30 p.m. to 5:30 p.m. We're also asking that you practice social distancing, and what social distancing means is having 3 feet between you and another person. So again, if you're outside, walking on our paths, coming throughout the building, we ask that you practice that social distancing as much as possible. Our transportation services are going to continue to be canceled, and that is going to be only limited to a grocery store visit, a doctor's appointment, and the metro runs that are for employees, and we're seeing our private duty aides as a member of our employee team at this time. We also are doing an additional screening that's now required by the Maryland Department of Health for all employees and visitors that are coming into our health center. So for all employees and visitors, that would include our private duty aides, we are asking that they enter one single point of entry, again, being that security entrance. And when they come in, there is an additional to the questions, we are now having their temperatures taken. So again, it's a requirement from the Maryland Department of Health and through CMS that we take the employees' temperatures before they come to work, and anyone who has a temperature of 100 degrees or higher will not be permitted to work at that day. Other updates we'll continue to provide throughout as we go. At this point, we are going to make the decision to extend the campus closure through the rest of March. So again, going through Tuesday, March 31st at this time. We're working with our Kendall affiliates and other team members, other different agencies, the Prince George's County Department of Health and Ombudsman, the Maryland Department of Infectious Disease and Control, to continue on webinars and to get further information so that we can bring that information to you, so make sure that it's timely. I would urge you to continue to monitor the CDC website for different tips, and for other information we'll send out as timely as possible so that you have it. And with that, I'm going to turn it over to Dr. Hanawi from MedStar Center for Successful Aging to give us some more information at this time.
Thank you, Megan. Good afternoon, everybody. First of all, I will start with what I started with before, which is there's a lot of anxiety there, and I think it's really important that we stay grounded. There's no need to panic. We will continue to do everything possible, all of us here, to make sure that everyone is safe and everyone is taken care of. I just want to touch on two areas. The first one is what Megan had brought up about the Creighton Center. It's so critical that we protect the folks up there. I've been through circumstances where we had the flu in one of our centers and it spreads extremely fast. If it hits one person, it's going to affect everybody. So we will kindly ask for your assistance in this, just making sure that we keep those folks safe and protected because they're vulnerable, and also if it spreads to one, it spreads to employees, but it spreads also to everybody in the facility. That's the first part, and please excuse that kind of difficult decision, but it is so critical to keep everyone safe, especially the most vulnerable. The second part, I just want to update you about a couple of things that MedStar Health is doing about ambulatory clinics, and we're going to do them here too. For the next couple of weeks, we're going to look at the schedules, and we're going to make sure that those folks that have an appointment with us that are there just for a simple follow-up visit, that we're going to call you and offer you to do the visit by phone or reschedule it to a later date, because we want to protect you also from coming to a place where there can be some sick people. I'm not trying to scare you. Most of the time we're screening everybody. So if somebody calls and they're not feeling well, we're screening them over the phone before we bring them to the office, just for the safety of everyone. But we will call you and ask you if you feel you don't need to see the doc, or if you can do the visit by phone. We're going to do that for you rather than bringing you down to the clinic and get you exposed to whatever it is. Again, every possible safety measures are placed in the clinic. You will realize that if you do walk into the clinic, there's a stop that will kind of force you to stop anyway, and we'll ask you a few questions, because if there is somebody that is highly suspicious for the virus, we're going to get those folks to the room. We're going to close the doors. We're going to put the gowns and the eye protectors and the masks and everything, and assess them and connect with the health department to take care of them. This is an extreme scenario. I don't think we're going to go there, and I hope we never do. But just giving you some thoughts about some of the steps that we're going to do to keep you all safe and taken care of. So please, if you get a call from Reka, Lawanda, Carolyn, or myself saying, how do you feel about your visit next week or the week after? Do you want us to reschedule it, or there's something urgent, or we can discuss it over the phone? Think about it, and we'll work on that together, because we're going to try to keep you in your place. The other part is, I just want to remind everybody, please don't walk into the clinic. It's really hard to keep everybody safe when we don't know what's coming. So please work with us on just making sure that everybody is safe, because if the staff get exposed also, they will spread it to some other folks and it becomes a challenge. One other thought that I had in mind, and I can't think of what it was, but we'll think about, actually I do. If you are someone that is coming back from a trip, whether it's a domestic trip, on a flight or on a busy train, or it's an international trip, we will ask you to self-isolate, but we will also ask you to notify the clinic, Megan, Ann, or anybody that you have been on that trip, and you're going to do self-isolation, and we're going to try to work with you on checking your temperature and all that. So if you can just think about those two or three things that we just discussed about the clinic, about self-isolation, about the rest of it. I think we're going to try to keep everybody safe, and I'm hoping that few weeks down the road we'll be looking back and saying we've gone through this safely and everybody's going to be okay. Thank you.
Dr. Howard,
Yes.
do you want to talk about being outside, if they want to take a walk or sit in the courtyard?
Sure. The question that Anne is asking me is to comment about folks that want to be outside, and what we mean outside is outside on campus. If you decide to be outside, and that is okay, just use the social distancing type of protocols that I think Megan have shared. Some people say 3 feet, some people say 6 feet. So I might go with the 6 feet, not to kind of override what Megan said, but I'm not sure there's a clear documentation of what is social distancing parameters are, but I would suggest 6 feet. If you're out in the courtyard and you want to sit and enjoy the weather or something, just make sure you're 6 feet away from other folks and just avoid large social gathering. Again, please don't do anything that involves high volume folks. I was asked also to comment about going off campus. I don't think we can restrict that significantly, but my suggestion will be to avoid going to places that are crowded. Movie theaters. Again, I told you I had a fight with my priest about social stuff and all that. So just avoid being in crowded places. And again, just if you do have concern, or you come back from a trip, just let us know and we will work on making sure we assess you properly, we're screening you and doing all that stuff. The team here at Collington and the MedStar team are here to take care of you, and you are our priority, and we'll make sure we're doing everything possible to achieve that. Thank you.
So 2 questions that I've gotten a lot of is if somebody is deemed an essential visitor for a resident's social well-being and they need to come into the health center, what kind of screening they'll receive. They will do the same screening that our employees and private duty aides are receiving. There's a series of questions and they will have their temperature taken. The other question that I've gotten a lot of is whether or not the transportation would go to church services or if church services are canceled. At this time, the transportation will not be going to church services. Again, you may have heard from Governor Hogan that anything for large quantities of people is essentially being canceled, and we're getting regular updates of those services that are being canceled. So those are the 2 questions I've gotten quite a bit of. And then lastly, the question about outpatient therapy has came up. So if you are a resident who utilizes outpatient therapy, you may continue to do so. We ask that you enter through our security entrance to be able to utilize the outpatient therapy at this time, and the therapy team will work with you as far as whether or not you needed to go through that screening or whether or not perhaps you may delay your appointment. And I'll turn it over to Anne for final remarks. Thank you all.
Thank you, Megan and Dr. Nawe. Just 3 things. If you are a traveler and you want us to know that you've been out of state or out of the country, please let the clinic know and Karen Cheney. Karen's going to be the keeper of our list of folks that have been traveling. The second thing is that we know that it's going to be cabin fever for a while. So our team is going to be working on a series of fun things that we can share on 972, and we'll be circling back with you about that. The third thing is that because our administration team are going in and out of campus every day, I'd like to restrict residents from visiting the administration offices. Again, just to be super safe, but if you need us, we're a phone call away, okay? Thanks so much, and we'll talk soon. Thank you.